All right, everybody, welcome back to the Deep Dive.
Yes, welcome back.
Today, we are diving deep into the world of Medicare eligibility.
Medicare eligibility.
And, it might seem like a pretty straightforward thing, right?
You would think so, huh? 65, you're in.
Right. You hit 65, you get the gold watch, you're good to go.
Exactly.
But it turns out it's a little bit more complicated than that.
Yeah, it's a lot more nuanced than folks might realize at first.
Yeah, so let's start with that.
Okay.
I kind of like, the classic scenario.
Yeah.
Turning 65, right?
Right.
So you hit the magic age.
Yes.
What happens then?
So, assuming you've been paying your Medicare taxes for at least 10 years,
Yeah.
you've been contributing to the system.
Right, got to pay your dues.
You gotta pay your dues, exactly.
Right.
Then you are eligible for premium-free Part A.
Okay. Premium-free Part A.
Premium-free Part A.
So what is Part A?
So Part A is your hospital insurance.
Yep.
It covers your inpatient hospital stays, skilled nursing facility care if you need that,
Okay.
and even some home health services. So that's kind of like your bedrock of Medicare coverage, It's there to provide that essential safety net if you need serious medical care.
Yeah, no, that makes a lot of sense.
Yeah.
But, we were talking about how Medicare isn't just a retirement program.
Exactly.
But what if someone's dealing with a disability
Right.
that prevents them from working, before they hit the age of 65?
Yeah, absolutely.
What happens then?
So that's where Social Security disability insurance comes in.
SSDI.
SSDI, exactly.
Okay.
If you are under 65 and you qualify for SSDI benefits,
Right.
meaning, your disability is severe enough to prevent you from working,
Right.
then you actually become eligible for Medicare after you've been receiving those SSDI benefits for 24 months.
Okay, so there's like a 2-year waiting period.
Yeah, there's a 2-year waiting period.
I see.
And it's,
For Medicare.
yeah, for Medicare, even though you're already receiving SSDI,
Yeah.
it's a little, that can be a little bit of a head scratcher for some folks, I think.
Yeah, 2 years seems like a long time to wait when you're already dealing with a serious health condition.
Oh, absolutely. And, it is a complex issue.
Yeah.
And there's a lot of historical kind of reasons why SSDI and Medicare were initially designed the way they were.
Right.
But yeah, that 2-year waiting period, one thought is it gives time to kind of evaluate the long-term nature of the disability and make sure that, resources are being allocated to those with the most persistent and severe conditions.
So it's kind of about balancing access with responsible resource allocation.
Exactly. It's a tough balance to strike for sure.
Yeah, absolutely.
Yeah.
But it sounds like there's some exceptions to that rule.
Oh, absolutely.
Right.
There are certain conditions
Yeah.
where that 24-month clock doesn't apply.
Okay. Give me an example.
A really striking example is ALS, also known as Lou Gehrig's disease.
Right.
ALS.
But the people with ALS.
Medicare kicks in immediately. Correct?
Immediately upon receiving SSDI benefits.
Wow.
So no 2-year wait.
Okay.
And that's because,
Why is that?
well, ALS is a devastating neurodegenerative disease, and it progresses very rapidly.
Right.
And the need for really extensive medical care
It's immediate.
is immediate, and it's very, very costly.
Wow.
So you can see how that exception really underscores how Medicare strives to act as a true safety net, recognizing that some conditions just require that immediate and comprehensive support.
Makes you appreciate the nuances built into the system.
It really does.
Yeah, absolutely.
Yeah.
I do.
Yeah.
So we've talked about age, we've talked about disability, we've talked about ALS. Let's shift gears to another surprising path to Medicare eligibility.
Okay.
Let's say someone is 40 years old.
Okay.
And they are facing a life-altering diagnosis.
Like end-stage renal disease.
ESRD.
ESRD.
Yes. Big word. Big implications.
Big word, big implications, and they need dialysis or a transplant
Right.
just to survive.
Yes.
How does Medicare step in for someone in that situation?
Well, ESRD is a prime example of how Medicare eligibility goes beyond just age.
Okay.
So individuals with ESRD, regardless of their age,
Regardless of their age. Wow.
can qualify for Medicare. And that's because,
Sure.
treatment for ESRD is intensive, it's ongoing,
Yeah.
and it's incredibly costly.
Right.
And Medicare steps in to provide that crucial financial support.
So it sounds like Medicare is really taking into account the severity of the condition and the financial burden associated with it.
It absolutely does. It's about recognizing that for some conditions,
Right.
financial toxicity can be a huge barrier to getting the care that you need.
Absolutely.
And so Medicare tries to alleviate that burden as much as possible.
Are there any other requirements
Yeah.
for someone with ESRD to qualify?
Yes, there are a few other criteria,
Okay.
often related to work history
Right.
or dependence on a qualifying family member.
Okay, so give me an example.
Sure. So, for example, you might need a certain number of work credits
Mm-hmm.
to qualify based on your own employment record.
Right.
Or you might qualify based on a spouse or parent's work history.
I see.
So, there are different ways to kind of meet those requirements.
So it's not just a blanket eligibility for anyone with ESRD.
Right.
There's still a process and specific requirements that need to be met.
Exactly. Yeah, it's about, as I said, striking that balance of making sure the program is accessible to those who need it,
Right.
while also, maintaining some guidelines for eligibility.
Right. So we've covered age, disability, ALS, ESRD.
We've covered a lot of ground.
We've covered a lot of ground.
Yeah.
What are some other just like essential eligibility factors
Yeah, good question.
that people should know about?
So two key things that I always like to emphasize are, first, citizenship or residency, and second, Social Security or railroad retirement benefits.
Got it.
So in terms of citizenship or residency,
Yeah.
you need to be a U.S. citizen or a legal permanent resident who's lived in the U.S. for at least 5 years.
Okay, so there is a residency requirement.
There is a residency requirement, yeah.
Got it.
And then generally speaking, you also need to be eligible for Social Security or railroad retirement benefits to qualify for Medicare.
So it's not just about your health conditions
Right.
or your age. There are these other factors at play as well.
Yeah, and I think that's an important point to emphasize because it really highlights how Medicare is woven into the fabric of our social systems, right?
Right.
It's about recognizing a lifetime of contributions, whether through work or through residency.
It is fascinating to see how intricate the system is,
It is.
with all these different pathways and considerations,
It is a complex system.
clearly designed to support people
Yeah,
facing a variety of challenging situations.
absolutely. And I think that's one of the things that makes it so important, but also potentially a little bit overwhelming to navigate,
Yeah, and that actually kind of leads me to a
Yeah.
question I had, which is, given all
That-
these nuances,
Right, yeah.
how can we simplify the process?
Yeah, that's the million-dollar question.
Or at least ensure that everyone understands their potential eligibility?
Yeah, I mean, it can be so overwhelming to try to navigate this on your own,
Right.
especially if you're already dealing with a health condition or, caring for a loved one who is.
Right. And so for all our listeners out there,
Yeah.
if any of this has sparked your curiosity
Mhm.
or you're wondering about your own situation,
Yes,
I really encourage you to dig deeper and explore the resources that are available.
absolutely. And, the good news is there are resources out there.
There are?
There are organizations and websites dedicated to helping people understand their Medicare options.
Awesome.
So, don't be afraid to reach out and ask for help if you need it.
Knowledge is power.
Knowledge is power, especially when it comes to your healthcare.
Could not agree more.
You might be surprised to learn that you qualify for certain benefits or programs that can make a real difference in your life.
All right, everybody. Thanks so much for joining us on the Deep Dive today.
Yes, thanks for listening.
We'll see you next time.
See you